So this will be the part 2 of the endorsement handoff/cardex report. So if you haven't watched the first part of this video, please do watch it first before moving to this part. So like I said, my first video, we'll be discussing the forms that we use to hand off, some terminologies that you might encounter that kind of is different from what you're used to. So just some things to help you familiarize when you arrive here in the United States and whenever you start your journey as a nurse. Okay, so now let's continue. The next will be the cardiovascular. If you had a report and you said the patient is on tele, means they have a telemetry on. So it means they have those small devices, or sometimes either like a pocket one that is a portable one, has like feeds 1, 2, 3, 4, and 1 here, 5. So, and sometimes they have like a SpO2 that connects to the device to check their oxygen level as well. So that's what they meant for tele. Sometimes it's not portable, sometimes it's connected to a big machine on a monitor over here. Most places, they normally use the tele ones because I think the things on the monitor are more expensive. If they are on telemetry or on telemonitors, so then you can determine if patient is sinus bradycardic, normal sinus rhythm, sinus tachycardic, or patient has an AFib or history of AFib, and it shows on your telemetry, or has an A flutter, or ventricular pace, then PACs, PVCs, patient has an AICD or implantable cardioverter defibrillator. Normally patients who has a pacemaker, sometimes they have a regular pacemaker or sometimes they have this kind of pacemaker, but it's kind of like a combination of pacemaker and AICD. Pacemaker just helps control rhythm. For AICD, it delivers shocks to the particular patient's heart and it fixes the rhythm. I had a patient before wherein on the monitor it catches like patients having like a VTAC, then after a few runs it just fixes to normal. So I didn't know at the time that the AICD was already fighting and fixing that heart rhythm. So that's one thing I learned during the time when I was doing like a CVU. So take note of patients with an AICD, okay? If you have those runs, just inform your doctor or cardiology on board about this particular reading that you catch on the telemetry. So if you're not familiar with pacemaker or AICD, you can normally see that either here or here, but most of the time they're always here. The next, if you can hear some murmurs whenever you auscultate their heart, or they have a heart block, so like winky back 1, winky back 2, so take note of this, okay? Of course, next will be edema, especially for patients who have CKD or ESRD or congestive heart failure. So you can normally find patients with edema, okay? So either none, generalized means like generalized means like everywhere, and trace edema is like just slight edema on some parts of the body, or 1+, 2+, or 3+. So you have to know how to determine either if they are like a 1+ or 2+ or 3+ kind of edema for your patients when you're doing assessment. Okay, so sometimes they if they fall under this, means they are on a pitting category. If they're non-pitting, then they don't have any like a +1, +2, +3. Okay, then the next will be the RL bilateral. So it's just like location. If it's in the arms, just write arms on the right side. If it's on the legs, then circle the legs. Then encircle like left or right or both legs. So next will be the pulses, either the DP or radial. How did you find the strength for the palpation on these pulses on those particular locations? Are they like +1 or hard, moderate, or like hard to auscultate, or you cannot get it through normal palpation and you need to use a Doppler machine? Some places they have a Doppler machine, some units they don't have. Okay, so yeah, we try to determine those things. Particular patients who have problems with circulations, like peripheral vascular diseases, or patients with clots on their legs, like DVT, so sometimes they use this, okay? The next will be the gastrointestinal part. Of course, normally you ask what diet your patient is in. So it can either be regular diet, clear diet, full liquid diet. So it says here AHA or American Heart Association diet. So we don't normally call this an AHA. We usually say like HH, or heart healthy diet, or healthy heart diet. So that's the most common one. Then the next one is the ADA. It's I think American Diabetic Association. So normally we just call this a CC, or carb control diet, or carb consistent, or consistent carb diet. So either, it depends per hospital, but normally it's like CC. So that's what we normally put in as an abbreviation. The next will be the dysphagia. So here normally
some nurses are trained to assess if patients have problems with swallowing. So normally ER and ICU are normally who are trained for this. And for med-surg or other floor nurses, usually you have a specific protocol that you follow to test the waters. And some part of the test fail and normally don't proceed. You either call the ST or ask someone else to do the speech evaluation for you or the swallowing evaluation. So this is really important, especially if you're in the ER or you had a new patient. So no meds if they have problems swallowing. Okay, so it has a particular level of 1, 2, or 3. So normally we don't really have this. So another diet will be the soft diet. So of course, like patients who just came in from surgery. Then next will be the renal diet. Patients who have problems with like CKD or anything to do with their kidney function. So low in potassiums or controlled substance for sodium levels. Okay, then next will be the NPO. Of course, very common. Patients will be going for procedure or patients who have problems swallowing or awaiting ST or speech therapy evaluation. So normally we put them on an NPO status or nothing per orem. Next part for your abdominal assessment is auscultation, of course, aside from the palpation. So auscultation will be like either hypoactive, active, or hyperactive. So that's usually the 3 things you choose from. So if patient is nauseated, vomiting, or having diarrhea, so just something to mention to your next shift. Then of course G-tube or the gastric tube. So back home I think we call this as an NG tube. So LWS is low wall suction. So means the suction is connected to the NG tube and it goes straightly to the canister via the wall suction machine. Or sometimes they can be on a gravity wherein just you put the bag lower than the head or nose part and just let gravity flow out from your belly. So that's usually the 2 cases. Then ostomy, of course, any holes on your belly. So that's one thing. And another thing is the last bowel movement. So some hospitals are quite strict for this, some are not. So it really depends. But it's really nice to mention that when was the last time they had a bowel movement, especially if you're giving out meds, especially if you're a day shift nurse. Sometimes you have like PRN meds under your MAR or medication administration record. And it's just nice to know that when was the last time they had their bowel movement. So just to help with getting your meds. Not included in the paper, but sometimes we put in like the palpation, if it's distended or like rounded, obese, or what else or flat or normal. So either way, sometimes we put it here as well. The next square will be the genitourinary. Okay, if patient is voiding or patient is Foley or patient is incontinent, they cannot control their bladder, and sometimes we include here the poop as well. Then anuria, if the urine has a clear, cloudy, yellow colored or amber colored or bloody. Okay, so this kind of basic thing. Oh, one thing to add here for the genitourinary, sometimes we say patient uses urinal for him to pee, or patient is on a pure wick. Means is the female device that you hook to a suction machine and puts them on their vajayjay or near the vagina or the urethra. Whenever they pee, it sucks the urine going to a canister. Okay, I'm not sure if some of you guys are familiar with this, but this is how it works. And pure wick is normally what we use for the female ladies. I'm not sure what the specific term for the guys. We also have this version for the guys. For the female, it looks like a hot dog or a banana, and you can like bend it. Then for the guys, it kind of looks like a plastic wherein there's a small hole and you put the penis inside, and it's like some tape on the top part to hold it from falling down. So that's what it looks like. And of course, it's connected to a suction and to the canister as well. And normally we use from low, that's what they advise, low to moderate suction level. So it depends the protocol for your particular hospital. Okay, it works sometimes, but sometimes it doesn't work. So usually you still have a diaper or a chucks underneath to make sure it won't wet the bed if it spills over. Okay, and also you have to change this, I think every 12 hours or per shift, or every 24 hours, depending on your hospital protocol. I really forgot the term. I'll just put here a picture of it. Sometimes we call this a man wick.
Okay, so that's what we call for the guys. So pure weeks for the ladies, a man week for the guys. The next will be the musculoskeletal. So if patient has a weakness, so patient is like has a fall and has been weak, particular for the legs, both legs. So encircle the right and lower extremity. So RLE, right lower extremity, and left lower extremity. If their arms are weak on upper side for whatever reason, like for patients who had a stroke, so you can put here like a right upper arm weakness and right leg weakness. Usually it's like a unilateral, and you can put in a strength on whatever strength you want to put in. And of course numbness, same thing, whichever location. Then here, skin or wounds or dressing. So we have different kind of terms here for these kind of things. For example, if your nurse says patient has a midline incision with staples on it, so they usually mean like incision on the abdominal area. That's what they call a midline in the middle, okay, and has staples on it. Then they will say like open to air means there's no dressing, or sometimes they will say like it has the glue dressing or the transparent glue dressing. So the clear one, it doesn't look like it has a dressing on it. It looks like it has a glue, like by the word itself. Or they use an island dressing or the Mepilex. So you have to be familiarized with some of the dressings that they use here. Mepilex or Aquacel AG or Alevin. So whatever dressing they have. Or sometimes they just use a wet to dry dressing. Okay, that's very common here. Wet to dry dressing means you have two kinds of gauze. One gauze, which is found on the innermost part of the patient's wound, will be a gauze that's like wet with something, with either saline or some solutions that the doctor recommended, and is covered by a gauze outside, like a dry gauze, just to cover, to seal the wet dressing inside. So that's a basic thing here. They use wet to dry dressing. So if patient has an abrasions or bruise, so you take note over here, wherever part or pressure source, you have to put here, and what dressing they use for this particular patient. The next will be the BG monitoring or the blood glucose monitoring. Okay, so here, like I said earlier, ACHS. So normally it's the ACHS. That's what we normally just use the word. So AC is before meals, and HS is before bedtime. Okay, so just write here whatever the glucose level were during the time. So the first one is before breakfast, before lunch, before dinner, and before bedtime. Okay, so but if they're under like a Q6 monitoring, so just encircle Q6. Alright, we're almost there. Next will be the drains. Of course, drains will be like a chest tube. So a patient has a JP or a hemovac, accordion. I'm not really familiar with the word accordion. Wound vac. So these are the common things that you can find, like a drains attached to a patient. Like in my floor currently, we normally have either a JP drain or a wound vac. That's what we normally use for our patients. Then, of course, you have to take note if they have like a JP drain, take note what kind of drainage they have. It's either like serosanguinous or sanguinous, and have like a purulent dressing, purulent exudate or output, minimal, moderate, a lot. So whatever description you can put in. Okay, for the labs, you don't really have to put everything here. Usually, we just write in here the specific things that we want to hand off or the abnormal things. For example, a patient has a WBC of 25, so you put it here. So we wanna take note of those things, especially if we wanna see if the patient's like WBC is trending up or trending down, or a potassium of 3.5 or 3.2. So, like in my particular place right now, if a patient has a potassium 3.5, then we automatically have to give the patient some forms of replacement, either via pill, IV, or by a liquid solution. So we have those protocols in place. Then you have to take some blood tests after a few hours for that. So whatever you want to take note for the labs, you can put here. Like for CHF, patients with a high BNP or patients with an MI, so you can put the trop I with abnormal here. So whatever you think it's deemed important to monitor or hand off to the next shift for the labs. Next will be the recommendation. Okay, scheduled procedure. Example, a patient is going to undergo an ultrasound in the morning, so just encircle ultrasound. So sometimes they need a fasting, so you encircle the NPO at midnight. Okay, so that's what you have to do. or a patient has a catheter procedure next day, heart cath, or stress test, echo, Dopplers, or MRI. So you can encircle those just so the nurse receiving a report will know about this. Okay. Then of course the consults, like CM is case management.
Case management helps with needs for discharge. If they need referrals for home health, rehab, SNF, or nursing home, medical equipments at home, transportation going home, or to a facility, many more.
If patient has some problems with some forms wherein they need some help, case management comes in to the picture, and sometimes they refer to different departments. Then PT, of course, physiotherapy, OT, occupational therapy, so GI or gastric doctors, cards or cardiology, neurology, nephrologist, wound care or wound nurse. Okay, so you have to encircle this if patient has wound referral, depending on your protocol in your particular hospital. For example, in our hospital, if patient has a pressure sore, sometimes we just automatically put a referral for them to see and have their initial assessment to see the patient and to recommend a particular kind of dressing that they think is good for this particular pressure sore that the patient has, and they'll be the one helping to monitor you, doing the dressing as well sometimes, and to see if it's improving or not. And they will put in the orders whatever dressing they want to use for this particular patient in order for the nurses to carry out. Okay, and I think some of the wound nurses are also like an ostomy nurse as well, or patients with ostomy or colostomy, ileostomy. So sometimes they do come into the picture as well. Ortho or bone doctor, psych, pulmonology, surgery. So these are the kind of consults here. I think one missing here is a social worker consultation. So some patients who has problems like going home or needs to go to specific locations when they're going to be discharged, sometimes we put in a referral for a social worker, or normally the doctors do it for them, but it's just nice to take note of the notes for them. Okay, that's one thing I do here is also I read the social workers notes as well. Okay, next will be discharged to. Back in the Philippines, normally most patients will just be discharged to a home. Okay, so that's the basic thing for us back there. But here in the US, or even when I was in Singapore, they can be discharged to a different locations depending on the healthcare needs they need before they can go home safely. For example, if a patient came in to your hospital who had a broken foot, and you don't think they are okay to go by themselves and take care of themselves, then you can refer them, or the doctor will refer them to either a rehab setting before going home to make sure they're fit to go home and safe. For example, they're not fit to go home and they need some kind of care at home, so sometimes they will be referred to home health, meaning a nurse or a CNA or some of the members or the home health team will come and visit the patient and provide care from time to time. They won't be there like 24/7. They usually just be there for a few hours and do some specific treatment like a wound care or just help the patient like turn or clean up, so not in a consistent basis for the 24 hours.
Next will be the assisted living facility. Assisted living is for people who need help with daily care, but not as much help as a nursing home facility. It's like an apartment complex that has some medical staff working in that facility.
So next will be the SNF, of course, a skilled nursing facility, if they're gonna be referred. And sometimes for this or the rehab setting, normally you will hear your nurses or your other nurses will head report, we're just waiting for a pre-cert. Okay, pre-certification, meaning once they send referral to the SNF, they're gonna wait for this particular SNF or rehab to return some documents to you, like a certification that they're okay to go to the particular places. Okay, so pre-cert. Okay, or sometimes if patient is not for discharge but rather for a transfer, so you can put it here as well, transferred to a different hospital, and we're just waiting for a bed. Sometimes it takes days or weeks for some patients to be transferred to specialized hospitals. I think I had a patient who stayed for a week or almost 2 weeks just waiting for a specific bed for him or her to go to the particular unit. Okay, I think that concludes it. At the back page, of course, you can write whatever you want right there, just like a notes or something for you to take note and you want to pass on to the next shift. So you can write whatever you want here that you deem important. Okay, so I know it was long.
and overloading of information. I hope I did not overwhelm you with those words or instructions or teaching, okay? So, but if you have any questions, please comment down below. I'll try to reply them, okay? And please don't DM me anymore. I can't reply anymore. There's too much. There's too much mails. It takes me like 2 hours just to finish replying like half of it. So please, just email me if you need a referral for something, okay? So again, hopefully you will learn something from this video. If you did, please help me support my channel and my other pages as well. So you can find my TikTok, Facebook, YouTube, what else? Beacon, Amazon. So please try to check them out, okay? And my Beacon, okay? So if you did, please help me support back. I'm Nurse Juan de la Cruz, your OFW nurse. Thank you for watching. Bye-bye. God bless. Stay safe.